It's day one writing. We're doing a simple letter. This is task 28, right? So of the 50 task file, yeah. Read the task for me, Dr.
Referral letter.
If you could read the task for me, Dr. Zishan, what does it say?
Using information given in the case notes, write a letter to referral. Write a letter of referral to Dr. L. Roberts, the admitting officer at Newton Hospital, 1 Main Street, Newton, for advice, further assessment and treatment.
Okay, that is good. So do you all agree it's a referral letter? Do you agree with Dr. Zishan being a referral letter? Does everybody agree? I need interaction here.
Yes, ma'am.
Everybody agrees? Yeah. All right. Tell me, what is the reason of referral? What is the thing that you should do in the letter that if you don't do, they'd not give you marks? Can you see something in here that if you don't do, they would not give you marks? What's the task here? It's a referral letter. You got it right. So Dr. Zara, if you could tell me, what is the task here? Yes, Dr. Zara, what's the task here? Yes, Dr. Zara, can you hear me? Dr. Misbah, can you hear me?
I think it's for further management.
Okay, further. Okay, you said further, right? Can anybody else tell me what's the task here? Why are we sending this letter? Dr. Moaz, can you tell me what's the reason we're writing this letter?
Patient requires urgent hospitalization. This is why we are.
What does it say just in the task here? What does it say just in the task here?
It says for advice, further assessment and treatment.
That means that if you do not write this in your introduction, you're not going to get marks. Do you guys understand? Writing task says write a letter of referral, admitting officer, right? This is their address for advice, further assessment and treatment. Meaning if you do not write these 3 words, you're not getting marks. If you just say, all right, I know that, this all just means management. And if you just write like all of it together, right? Like you use just one word for it, which is management. And you say, yeah, I know, like in English and we're doctors, what we do is we just, we can use one thing, one word, management. That is it. If you do that, you're not going to get marks. Do you guys understand that? Is everyone clear about it? If you do not write and you try to suffice this thing with just one word, management, you're not going to get marks. Is that clear? Dr. Moaz, Dr. Misbah, Dr. Zara,
Yes,
Dr. Fasi? Yeah, everybody clear?
Yes,
clear about it,
Thank
Dr.
you.
Amber? Clear?
Thank you.
Now here's the thing. Now, I've told you that you guys have 45 minutes, but I want you to practice a letter in this time. Okay, it doesn't matter if it's the first time you're writing the letter. If it doesn't matter that you've been a pro at it. You need to rebrain yourself. You need to reprogram yourself in this thing. 5 minutes to read the task. Okay, 5 minutes to read the task, right? 5 minutes to read the whole task. 5 minutes to write the introduction, right? 5 minutes to write the introduction. 10 minutes to write the body. Okay, how much that makes? It's 20 minutes, right? 20 minutes. And 5 minutes to write the conclusion. How many minutes are these? Can you guys count? 25 minutes, right? 25 minutes. Then the 10 minutes you would have for review or anything else that you might want to add, right? Overall, what I'm trying to say is that please try and make sure you write the letter within 25 minutes max, right? I know this is a very gradual and a very swift change, but what I want you to do is I want you to program yourself like that. Because, at the time when you're going to be doing your letter on the exam day, it's going to get double. Right? You're going to lose double the time, right? Because you're thinking, you're frustrated, you're worried, and you're like, I've spent so much, I've studied so much, I don't know what's happening. I promise you that after we're done with this, you would be able to write any kind of letter that comes your way, right? Any kind of letter, anything that's there, you would inshallah be able to, write any kind of letter on your exam day, hopefully. Okay, guys, is that clear? Now, what you have to do is after you've read the task, after you've read the task, your next thing, instead of going up at the first visit, at the introduction, what I want you to do is immediately after reading the task, read the plan, right? Read the plan. Dr. Misbah, can you please read the plan for me? What does it say? Yes, Dr. Miswa, can you read what it says? Can you read what it says? Dr. Miswa, are you there?
Yes, of course. It's urgent hospital admission.
Read the whole thing. Read the whole thing.
Spoke with Dr. Robert, admitting officer, Newtown Hospital, ambulance, transport organized.
What does it mean? What does it mean?
An urgent letter.
It's
Urgent
an
referral
urgent
letter.
referral letter. Now, as we're talking about this, can any of you tell me the difference between urgency and emergency? What's the difference between urgency and emergency? Any idea? We're doctors, we work all the time in emergency, we always try and deal with urgent cases. What is the difference between emergency and urgency? Dr. Zishan. Yes, Dr. Zishan.
Ma'am, as we have read that hypertension urgency and emergency.
Okay.
Like in hypertension urgency, there will be end organ damage. And in emergency, there will be no end organ damage, but there will be emergency.
Okay, all right. Yes, Dr. Moss, what is the difference between emergency and urgency? Yes,
in
Dr. Moss.
emergency, patient requires urgent, immediate medical attention. In urgency, it can it can wait a little for a little while.
Okay, all right. Yes, Dr. Sidra, what's the difference between emergency and urgency?
In emergency, there is immediate threat to life of the patient, wherein urgency, there is not immediate threat to life of the patient. The patient can wait.
Okay, all right. Yes, Dr. Zahra? Dr. Amber?
Ma'am, emergency is where we have to check the patient immediately, but urgency is that patient can wait for 24 hours, like it's not an emergency.
Okay, yes, anybody else wants to add on to this, Dr. Zish, Dr. Fasi, or anybody else? Right, see, here's the thing, right? In UK setting, what happens is that you have to treat the patient immediately within 2 weeks. Right, immediately within 2 weeks if it's an urgent case. Right now, what did I say? I said immediately within 2 weeks. Now the immediate depends, right? Urgent means that you can wait for the thing. Emergency means that if you do not deal with this patient, he's going to die. Now let's say there are two patients, both have them cancer, right? Both have them cancer. Now patient A and patient B, both of them cancer, but patient A has got, like he's having shortness of breath. His SpO2 is, let's say, 70 or 80, right? And patient B is stable vitally. Which one do you think is urgent and which one do you think is emergent? Dr. Zahra.
Ma'am, patient A needs urgent treatment, and while patient B can wait.
Okay, all right, Dr. Fasi.
Many patients that have Down situation will need immediate attention.
But I'm saying that are both the cases urgent or not? That's my question. Anybody? Dr. Moss.
Can you?
Yes, Dr. Moss.
I'm sorry, I could not hear about the case B.
Okay, I'm saying both of them have cancer. Patient A has shortness of breath and his SpO2, which is oxygen saturation, is, let's say, 80%. Which one needs immediate attention? And are both of them emergent or both of them urgent cases?
Both of them are not urgent. Patient A is urgent and needs immediate medical attention.
Okay, all right. Thank you, everybody. Now, here's the thing. Please remember this forever ever, because you're going to work in any department, be it UK, be it USA, be it Australia, be it your own home country, you need to understand these two words. Yes, we've spoken about hypertensive emergency and urgency, but you guys are still not clear, right? And you know, when you understand these two words, you would know how to organize your letter, right? And MI, is it an emergency or urgency? Here's the thing. When I say urgent, I mean that the case can wait 2 weeks. When I mean emergent, right? Like for example, a person's got RTA, that's an emergency, right? That person needs immediate, meaning just now call the ambulance, he needs to go to the hospital, he needs oxygen on, he needs blood tests. Now here's the case. Both the patients who have cancer, it's an urgent referral. For example, somebody's got cancer of the skin, right? We know about the basal cell carcinoma. We know about the squamous cell carcinoma, right? We know about a lot of carcinomas. If anybody has got cancer, you diagnose this as a GP. Are you going to just wait around, or are you going to immediately refer? No, you're going to say, you know what, because it's going on, right? What we can do is we can urgently send you to the hospital, meaning within a 2 weeks wait time, we can send you to the hospital. But if the same person with cancer starts having MI, now it becomes an emergency. Is everybody clear about it? If you're not, I would want to repeat it. What I'm saying is, urgency means that within 2 weeks' time, you can deal with them. Emergency means that their vitality is at threat, right? Okay, their vitality, meaning their oxygen, their respiratory rate, the vital organs, right? The brain, the heart, the lungs, right? The kidneys at times, those are going to be damaged. So we really, really need to in emergency send them. Urgent meaning, right? For example, your friend calls you and says it's urgent, right? You're going to be all right, fine. But if he says it's an emergency, then it's going to be more prominent and it's more imminent, more immediate. Everybody clear about it? I really want to know. If you're not, please let me know. I'll repeat. Everybody clear?
Yes,
Everybody
ma'am.
clear?
Yes.
Everybody clear? I want to hear a good yes, a powerful yes. Guys, don't be sleepy. I know it's too late, but don't be sleepy, okay?
Yes, ma'am.
Are you guys clear?
Yes, ma'am.
Yes,
Yes,
ma'am.
we are clear.
Yes.
Where's your
Yeah.
energy? Are you guys not eating? You guys work 24/7. You guys do 36 hours duties. What is wrong with you? Come on, wake up. All right, guys. So this is urgent hospital
Yes, we are clear.
admission. Okay, urgent hospital admission, meaning within a 2 weeks time. Right, within a 2 weeks time. Now, if this urgent situation is emergency, that depends on the person's condition. Now, after you read the plan, first thing is you read the task. You read the task. The second thing is you read the plan. Now you want to know the diagnosis, because if you guys remember, can you tell me what do we write in the introduction of a letter? Can anybody tell me? What do we write in the introduction of a letter? Dr. Misbah. Yes, Dr. Misbah. If you guys,
Can you please repeat the question? Can you
I'm
please repeat the
saying,
question?
what do you write in the introduction of a letter?
It will depend upon the duration of the case. If it's
No. Go back to
like
day
if
one,
the cancer,
where I taught you how to write the introduction. What do you write in an
yeah.
introduction? What does it include? Yeah.
To whom we are writing, why we are writing,
Please go
and
back and watch it. I've given you online access. I've given you Gmail. The recordings are available. You need to be clear about it if you really want to pass this exam, right? Please go back and watch it. Here's the thing. Can anybody else tell me? Please pay attention. All right, guys? I know it's late, but this is all the time I have, and it's very important that we do this. Tomorrow, inshallah, we'll be doing 10 p.m. Okay? So for now, anybody can tell me, Dr. Fasih, what does it include in introduction?
Yes, ma'am. The purpose of letter, that like why we are writing this letter, that include
What's the first thing that you
the
write in the
age,
letter? What's the first thing? Yeah, name.
that
Okay, name.
name, age,
Uh-huh.
occupation,
Okay. All right.
uh,
Anybody
and
else?
diagnosis.
Diagnosis, right? Like a provisional diagnosis or the real diagnosis, right? Name, age, occupation, reason of referral. Now, reason of referral, which
Reason
is
of
your ROR, right? Please see, I'm just making this formula so that you can write any kind of letter. I'm here to make it easy for you. right? I want to make it easy for you. If you don't follow it, you wouldn't be right. You wouldn't be, you know, like able to write a letter. Please watch it again. Please remember it, right? Provisional diagnosis, which includes reason of referral, right? Reason of referral, what you write after name, age, occupation, reason of referral, which includes what is the condition of the patient, meaning the diagnosis. What does the patient have? Right? What does the patient have? The second thing there is, why are we writing the letter? So here, after you've read task, you've read the plan, you need to see what is the diagnosis. He's got right lower lobar pneumonia, right? So that's her diagnosis, right? We have the name, right? We have the name. We're going to see what the name is. We're going to see what's his occupation. We're going to see what his age is, but we know the reason of referral. So his diagnosis is that he's got right lower lobar pneumonia, right? And the reason, and why are we sending it? Why are we sending him? Why are we sending him, Dr. Sidra? Why are we sending him? What he has is right lower lobar pneumonia. Why are we sending him? Yes, Dr. Sidra, why are we sending the patient?
Because
Yes.
he needs urgent admission.
Urgent hospital admission. That is a reason we're sending him, right? So the diagnosis of right lower lobar pneumonia, urgent hospital admission. Now, after you've read this, you don't want to do anything else. After writing task, after the plan, after the assessment, you want to go immediately to the first visit. And before you start reading the first visit, you need to count how many visits are there, right? How many visits are there? So task, right? Plan, okay? Task, plan, assessment. Now you need to count how many visits are there. So this is one. Okay, this is this one. Okay, this is another one. Okay, this is another one. Okay, okay, okay. So how many visits are there, guys? Can you count with me? This is one.
Three visits.
3 visits. We've got 3 visits, right? So we've got 3 visits. Why is it important for us to know how many visits are there? So that when you start writing out, you don't miss anything, right? You don't miss anything. Now let's begin reading our letter from the beginning. This is going to be always the same. They're going to say you have got 40 minutes, but what you're going to think is that I've got 35 minutes in total. Okay, 35 minutes in total. And all of you, trust me, all of you are able to do it within 35 minutes. Even if you think like you cannot write a letter, even if you think that your English is not good, I assure you that all of you are going to do it in 35 minutes. All right. Okay. So let's read. Mrs. May Hong, 43-year-old patient in your general practice, right? So that is her name. This is her age. This is her first visit. She came in 2014 first. When did she come next? She came again in 2014, right? Then she came again in 2014 of the same month almost, right? Subjective. What does it mean by subjective, Dr. Umber? What does it mean by subjective? What does it mean by subjective, Dr. Umber? Yes. Dr. Umber, what does it mean by subjective? Can you guys tell me what does it mean by subjective?
Patient has been experiencing
The things a patient has been experiencing, meaning something that he says or has, right? Or does, right? Says, has, or does. All right, like all the verbs that there are, says, has, or does. So he's having what, right? The things that he's been experiencing. Objective means something that you check, right? Something that the machine checks, right? That is objective. So he's saying that noted a productive cough over 3-7. What does it mean by 3-7? Dr. Zahra, what does it mean by 3-7?
3 days in a week.
3 days in a week. Very good, very good. No dyspnea or pain, feverish, continues to smoke 10 cigarettes a day. So he's been smoking 10 cigarettes a day she's been smoking 10 cigarettes a day on 7 February 2014. Everybody clear so far? Everybody clear so far? Okay? Okay.
Yes.
History says that they've got rheumatic carditis in childhood, resulting in mitral regurgitation, atrial fibrillation. From the objective, we find out that the temperature is 38, pulse 80. What does it mean by AF? Guys, what does it mean by AF? Dr. Moaz, what does it mean by AF? I'm going to zoom out a little. Yeah.
Atrial fibrillation.
Very right. Atrial fibrillation. Very right, right? Because see, at the back of the thing, you see they have made an abbreviation. This is their way of telling you that, if you want to use abbreviations, you can, but please first write them openly. Yeah. So that's how you know that it's atrial fibrillation. ENT, NAD. What does it mean? What does NAD mean, Dr. Misbah? What does it mean by NAD? Yes, Dr. Misbah, what does it mean by NAD?
No abnormality detected.
No abnormality detected. The moist cough is there. There is no abnormality in the ENT. It's scattered bronchi throughout chest. Otherwise, okay. Apical pentasystolic murmur. Assessment: acute bronchitis, cigarettes increase condition, severity to a plus. Advice: cease smoking, amoxicillin, no other medication unchanged, etc., etc. Now this is the first visit. Now what's the thing that you need to look for? In the first visit, they tell you mostly his social history. Right, social history, his past medical conditions. They tell you his marital status, right? They tell you, and they give you this stuff for the first introduction paragraph and the past medical history paragraph. Everybody clear?
Yes, ma'am.
Everybody clear?
Yes.
Yes.
Okay, now you guys have got 5 minutes. I've given you the letter. You've got 5 minutes to write the introduction here and post it on the WhatsApp group. Okay, you can write it on the pen, on the paper, take a screenshot. You've got only 5 minutes to write the introduction. This is task 28, page 31. Are you guys clear? Everybody clear about the task? I don't want to hear that you didn't hear me. Everybody clear? Everybody clear about it?
Yes, ma'am.
You guys have 5 minutes. Write the task, come back, send it on WhatsApp. I'm counting it. It's 1203, right? So at 12:08, I'm going to stop the timer, right? Sorry, like at 12:12. Okay, I'll give you that time. Okay, so you got 5 minutes. Go ahead. Right, so it says over here, if you see, it says the reason of referral is that she needs urgent hospital admission and she's got right lower lobar pneumonia. Now over here, as you have seen, right, that the patient is having, you've written, I'm writing to refer, you'll say, I'm writing to urgently refer Mrs. Hong, a 43-year-old whose features, instead of saying sign and symptoms, you could say whose features are suggestive of right lower lobar pneumonia, and she needs an urgent hospital admission. If you fail to write this, if you do not address the reason of referral, you won't get marks, even though it's beautifully written and all of the things are in here. So I told you that your reason of referral includes two things. Number one, what she has, which is right lobar pneumonia. And number two, she needs admission. Yeah. Clear?
We could not hear you clearly.
Is it clear?
Yes, yes,
Now,
clear.
can you hear me right now? You have to
Yes,
say,
yes.
I'm writing to urgently refer, because it's urgent referral. This is a 43-year-old woman. Now, you said comma here because these are connectors, right? Signs and symptoms. Instead of signs and symptoms, you should say features because that's concise, reduces the word count, are suggestive of right lower lobar pneumonia. For advice, further assessment, and treatment. One other thing that was the reason of referral is that she needs admission. Is that clear, Dr. Moss? You have to write that she needs
Yes.
urgent admission. Okay, is it clear?
Okay.
Is that point out, you're not going to
Yes,
get
it's
marked.
clear
Is that
now.
clear? Okay, all right.
Yes.
Good. This is Dr. Fasih. Dr. Fasih, are you there? Can you hear me? Yeah? Can you hear me?
Yes, ma'am.
All right, you're saying, thank you for seeing, Mrs. Hong. First of all, this spore that you've written, right? Now, it doesn't really look good, even though it's your way of writing. I had so many ways of writing that I had to change because I wanted them to pass me, right? So for should be changed because you see your F here on the off is different, of the further is different, this is different. It looks a little odd, as they say that you should be writing clearly, so you should not write this for like that, right, Dr. Fasih? Is it clear?
Yes,
Yeah?
ma'am. Got you.
And after Mrs., because it's an abbreviation, you're going to put a dot, as Dr. Moaz did, right? Put a dot.
Okay, ma'am.
Mrs. Dot Hong, a 43-year-old woman. Now you said who's or comma. You see, all of you have the same kind of mistake, right? Comma is a connector. Again, you are suggestive of right lower pneumonia. comma, she needs urgent hospital admission, right? And the three things that you missed: advised, further assessment and treatment. Not just further assessment, she also needs treatment. She also needs advice. Is it fair, Dr. Fas? Just doesn't
Yes.
suffice, isn't it? I
Yes,
told
ma'am.
say, yes. Even though this is organized, even though you not missed this step, but you missed the reason that you are writing the letter. You just don't want their assessment. You want their treatment. You want their their advice, right, Dr. Fas?
Yes,
Is that
ma'am.
clear?
Thank you.
Doctor,
Yes, ma'am.
good, good. Any questions? Any questions? Okay, all right. Dr. Umber, are you there? Dr. Umber, are you there?
Yes.
Okay, good. Now see, Dr. Umber has made one thing, and that is she has wrote the introduction, and she's also written the address, which lets us assess the situation. Now, after doctor, I'm gonna put a dot, right? Because you're abbreviating it, right? The full form is DOCOTOR, isn't it, guys? So you're gonna write Dr. Roberts. Comma. There are no comma in your address. You have to put Newton below the main street, right over here in this line. All right, Dr. Umber, is that clear? Can you hear me? Mm-hmm.
Yes. Yes.
All right, Dr. Umber. Okay, that is good to hear. So you see, when you say this patient, that means you've disowned them. A doctor is related to the patient, right? We have got doctor-patient relationship. If you start calling them this patient, then you're like, you know what, I don't like Mrs. Hong, so I'm going to just call her this patient. Even when you're speaking to a patient or a person, you use your first name to build a rapport, right? Now, if you are not there talking to the person, you're sending them this letter. This letter is your way of building a relationship with the person. Right, so you're going to write their name. You're going to say, I'm writing to refer Mrs. Hong, right? 43. Now you missed here. Dr. Umber, are you following me? Is that clear?
Yes. Yes.
A 43-year-old woman. Now again, you've done the same mistake. I'm not going to repeat it. You can say sign and symptoms, but it takes too much time. You can say features, or who has. Now you could say sign and symptoms suggestive of, or you can say who has, right, lower lobe base, who might have, right, who's provisionally diagnosed as a case of. So many ways of saying it. For urgent hospital admission under your care for further treatment, advice, and assessment. I told you, management is a holistic term, but if you don't write it specifically, you would lose marks, because they've specifically told you what we want from you to write, and they're looking at you if you're going to write it or not. Is it clear, Dr. Umber? Yeah?
Yes.
Okay. All right. Any questions? Okay. All right. Dr. Fasi, we saw yours. This is Dr. Zishan. Dr. Zishan, are you there? Quick. Right, Dr. Zishan, are you there?
Yes, yes.
Good. I'm writing to refer Mrs. Hong, a 43-year-old female. Good. Now, again, you did the same thing, comma or whose. Yeah, sign and symptoms, the same thing. Are suggestive of right lower lobar pneumonia. Your advice, assessment, and management regarding this patient. Don't say this patient. Just say regarding her would be highly appreciated. Good. What did you miss here, Dr. Zishan? One thing that you missed here. Can you say what you missed here? Anybody else can point out what he's missed?
Writing to urgently refer.
You've written urgent. No, you've not written that. What has he missed? Anybody knows what he's missed? One thing which is very important. If you and I read it, you wouldn't know what to do with the patient. Maybe he'll just sit on the stretcher and die. Hospital admission. You haven't written he needs hospital admission. Now you see, if I was reading the letter, I'll be like, all right, this person doesn't need admission. It's not urgent. I just need to advise him. I'm gonna make the patient sit in front of me. I'm gonna be like, all right, listen to me, dude. You've got pneumonia. All right. I'm gonna take your vitals. I'm gonna give you some tablets. Then you can go home. Isn't it? Dr. Zishan, do you understand what's happening here?
Yes, ma'am.
Right? So you need to write, she needs urgent hospital admission. If you don't do that, you lose marks, because your letter is talking to the person there. Everybody clear? Everybody clear? Is this clear? Okay, all right. Now this is Dr. Zahra. Dr. Zahra, you've written, thank you for seeing Mrs. Hong, a 43-year-old woman, right, who has clinical features suggestive of right lower lobar pneumonia. Your further assessment and treatment would be greatly appreciated. What did you miss here, Dr. Zahra?
Ma'am, hospital admission and urgent and advice too.
Good. Very nice. Also, you said clinical features. Now, you see, clinical features means just what you and I checked. There are so many things. So just say features. It's a holistic word. Right, Dr. Sarah? Clear?
Yeah, ma'am. Okay.
All right. And next time, are you taking a computer-based exam or a written one?
Written one, ma'am.
If you're taking written exam, please write it on a paper, because that way also see if you're making any mistakes. All right?
Okay. Yeah, ma'am. Okay.
And Dr. Sishan, your writing's fine. As long as I can understand your words, that's fine. Okay, this is Dr. Misbah. Dr. Misbah says, thank you for seeing Mrs. Hong, a 43-year-old female. Again, the same thing, don't write whose. All right, Dr. Misbah, are you there? Who's in comma doesn't go together. Clinical features are consistent with right lower lobar pneumonia. Further advice, assessment, treatment would be highly appreciated. And she needs admission. You missed on that, Dr. Misbah. Okay, I think he's not around. Okay, so I guess we covered all of you. Now let's go back to the letter. Okay. All right, anybody confused? Anybody confused? You're gonna write this letter. The next letter, your next task is this. Okay, everybody clear? No questions? We're gonna start at 10 because this is gonna be a long class. Okay, everybody clear? Good. Okay, see, advice, cease smoking, amoxicillin, 500 milligram TDS. What does it mean by TDS? Can anybody tell me? Just randomly start your mics, open up, be
3 times a day.
good. 3 times a day. Good. Go for it. Don't be afraid. Okay, don't be afraid. What does it mean by main? Because if you talk, you're also learning speaking. In the morning. What does it mean by nocte?
At night.
In the evening.
Very good. In the evening, at night. NKA, known allergies. What does it mean by 2-7?
2 days
Anybody?
in a week.
2 days in a
Twice
week.
weekly.
Good. Check prothrombin ratio next visit. This means that on the second review is on the second day of the week, right? Okay. All right. Okay. Now this is the second visit. They say that as a person, like he came with nothing, like he came with a cough that was there for the 3 days. He had no dyspnea, no pain. He was just a little bit feverish, and he had smoke. When you checked his temperature, it was 38. His BP was 140/80. He had moist cough. All right. Now, if you look at the second one, the cough increased. He said that the cough increased. There's thick yellow phlegm, feels quite run down. What did it mean by run down?
Tired.
Tired, right? He doesn't feel good. He feels unwell. Not dyspneic. Do you think it's significant to write not dyspneic? Does it mean significant to write not dyspneic? Because as you move along, if you move along, you'd say that, he's dyspneic now. This is why the things are important for you to see, because you see previously as he came, he had no bronchi, chest was fine, right? Right now, as he's come back, you see he has got, as you check he's got mild crackles. So how do you compare which information is important? This thing is progressing. Is everybody following me? Dr. Moz,
Yes,
Dr.
ma'am.
Zahra, Dr. Misbah, Dr. Fasih, Dr. Zishan, Dr. Amber. Everybody following me? Did I forget anyone? Did anybody leave behind? Okay, good.
Yes, ma'am.
Right, so you need to understand the situation, that, you need to select information which you think is going to be a problem in the next visit. If you left the dyspnea previously, you said, all right, he doesn't have it, I don't want to write it, but you need to check, is he having it later on? Because if he has it later on, you need to write it. Previously, he didn't have any bronchi, now he's having scattered crackles, you need to write that, otherwise unchanged. Okay, assessment is bronchitis, increased severity, early right basal pneumonia. Everybody following? Now, before we move forward, what I want you to do is, you've again got 5 minutes, not 5, let's make it, okay, 5 minutes. You're gonna write the past medical history paragraph of this patient. Okay, all right, 5 is a lot. Okay, I'm here. It's 12:32 on my clock. So at, let's say, 12:30, I'm bad at maths. At 12:37, I'm gonna ask you to stop. Please, your time starts now. You know the page number. Keep going, and you have to write the past medical history paragraph of this patient, and the time starts. All right, so this is what you guys have written. Okay, this is Dr. Moss. He's written, Mrs. Hong had history of rheumatic arthritis in childhood, which resulted in mitral regurgitation and atrial fibrillation. Additionally, she smokes, because it's a plural, right? Additionally,
Yes.
she smokes 10 cigarettes per day. All right, this is
Yes.
good, but after additionally, please put a comma, right? Please put a comma.
Okay.
All right, this is her past medical history. Now, here's the thing. When you're going to write the past medical history, I want you to write their social history first, right? Their social history includes that they are a drinker, they are a smoker. That's their social history. So you could say Mrs. Hong smokes 10 cigarettes per day, right? And we don't know how long that she's been doing that for. And after that, you'd say she's been, she's got rheumatic carditis, and in childhood, which resulted in mitral regurgitation, atrial fibrillation. Now, if she's taken some medication, you'd also write that. All right, doctor? Is it clear, Dr. Moss?
Okay. Yes.
All right.
It's clear.
Okay. Dr. Fasi is saying, Mrs. Hong, and we're going to talk about what you're left with. Mrs. Hong first presented to me. First of all, we spoke about it, Dr. Fasi, that if you say to me or to my clinic or to my hospital, you're already just referring to yourself, not to the patient, and you're being selfish. Okay.
Okay, ma'am.
All right, Dr. Fasi, is it clear? We
Yes,
come this
ma'am.
date. If you don't say it to me, they already know it's you. Otherwise, they'll be like, you know what, he wants to talk about himself. Okay, now here's the thing. In the past medical history paragraph, you don't want to talk about when they came first. You just want to talk about what is their past medical history. So their past medical history is that, she smokes 10 cigarettes per day. That's her past medical history. Please note she had a rheumatic carditis in childhood that led to, this is good, mitral regurgitation, atrial fibrillation. This is good, right? This is good. This is good. I don't think that there is any change I would want to know, except that, you don't need to write the things which are to be written in the coming paragraph. Is it clear, Dr. Fasi?
Yes,
Yeah?
ma'am. Thank you.
Okay. This is Dr. Zishan. He's saying she has been. Now, whenever you write a new paragraph, Dr. Zishan, are you there? Dr. Zishan, are
Yes,
you
ma'am.
there? Yeah, every time you write a new paragraph, she has been a known case of rheumatic carditis. You don't say she, you start with their name. Mrs. Hong has been a known case of, right? Rheumatic carditis since childhood. Good. You used it very good. You use with since has been, which is associated with mitral regurgitation and atrial fibrillation, full stop. Or you could say for which, not for that, for which, right? Which what? This mitral regurgitation, atrial fibrillation. This is good that you've included it. None of your friends did it, right, Dr. Zishan? So I must appreciate it. Clear?
Thank
But
you,
you'd
ma'am.
say Mrs. Hong has had or is a known case. Now you see so many words. You could decrease it by saying Mrs. Hong smokes 10 cigarettes a day. Okay, full stop. She has had rheumatic carditis in childhood, which resulted in mitral regurgitation and atrial fibrillation. Is that clear, Dr. Zishan? Yeah?
Yes.
For
Yes, ma'am.
which she is using, if you want to do that, digoxin and warfarin. Good, very good. Very good, Dr. Zishan. All right, the rest of you have just sent it. Time was up. I'm not going to check it. I might just read it, but I'm not going to take your name, right? Regarding her medical history, she had rheumatic carditis. She was a child that resulted in mitral regurgitation and atrial fibrillation. No. She was a child. No. She had it since childhood. Right, doctor? And please write it within the given time, okay? I know this is a beginning, but I want you to be like a pro from the day one. Is that clear? Can you guys hear me? Dr. Zahra, Dr. Fasi, Dr. Misbah, Dr. Zishan, Dr. Amber, everybody
Yes,
clear?
ma'am.
Yes, ma'am.
In the morning
ma'am.
group, those guys are like really, really, energetic. Even though they're from different parts of the world, they have different time zones, but they're still, very energetic. So you need to have energy. Tomorrow we're going to start off early, but show the energy, right, guys? Okay, now what I want you to do is letter. What I want you to do is I want you to write the last, the first paragraph that you write right after introduction. Whatever you think the paragraph is, you can write that. I'm going to read the rest of it. It says, cough ink quite run down, not dyspneic, taking all medications, no cigarettes for the last 2 days. Now you, as you progress in the letter, you're going to write in the second paragraph that, you know, on this day she presented with cough increase, she was tired, however not dyspneic, and she stopped smoking for the since the past 2 days. I'm going to say it again. Mrs. Hong presented on decreased cough along with thick yellow phlegm. Listen to me, this is exactly how I'd write it. And you're going to do it too, right? Just for today, I'm giving you some presented on this date with cough, increased cough, yellow phlegm, tiredness, no dyspnea. However, she had stopped smoking for since the previous 2 days. Clear? Okay. On examination, she had a temperature of 38.5, pulse was this much, atrial fibrillation, and on the right lung base posteriorly. All right. Okay. An assessment of bronchitis increased severity with severity, along with early right basal pneumonia was suspected. Everybody clear so far?
Yes.
You're going to write this. You're going to write this letter to me. The next letter is this your task. Okay, guys? Everybody clear? Dr. Zara, Dr. Isba, Dr. Amber, Dr. Zishan, Dr. Moaz?
Sorry, ma'am, but
Yes.
your voice was cutting and
Everybody
we
clear?
couldn't hear you properly.
If not, please ask me.
Can you please repeat it?
Dr. Zishan?
Ma'am, please can you repeat it because your voice was cutting and we couldn't hear you properly.
Can you hear
So-
me right now, Dr. Zara?
Yeah, ma'am.
Okay. Okay. Now, what I want you to do is, instead of writing the introductory, the paragraph right after introduction, I want you to write the first 2 visits for me. I'm going to give you 10 minutes. All right. And then we're going to end it. I'm going to give you 10 minutes. Write the first 2 visits for me in whatever way you want. I'm just going to read this just so that we're clear, right? Sputum sample for microscopy and culture, which is MNC, FPE, which is full blood evaluation, chest x-ray, chest physiotherapy, prothrombin ratio today, results in tomorrow review. Tomorrow. You guys have 10 minutes to write the first 2 visits. Can you do this? Can you guys do this?
We can
Exclude
try.
the introduction.
Okay, ma'am.
Yeah, exclude the introduction, exclude the past medical history bit, write the first 2 visits. You guys have 10 minutes. It's 12:51 on the clock. At 1:01, we're going to assess that. And at 1:10 or 1:15, we're going to end this. Okay? It'll be fine. All right, so you guys have written it. Let's just check your letters now. This is Dr. Amber. Dr. Amber, are you there?
Yes.
Yes, Dr. Amber. Okay, all right. It says, initially on this date, she, again, you have to start with her name, right, Dr. Amber? Mrs. Hong was diagnosed with acute bronchitis. I told you that unless it's a person's name, Parkinson was a person, right? Ehlers was a person, right? Alzheimer's was a person. Amber is a person. If you in the future have a name on your, you have a disease on your name, that's when you'd capitalize it, right, Dr. Amber? Is that clear? Can you hear me?
Yes.
Okay, just keep your mic on for a bit. So you would only capitalize the A then if it was Amber's bronchitis. Okay, that's when you'd capitalize it. Otherwise, no capitalization of both the words. You'd say acute bronchitis. She was advised to cease smoking and was prescribed antibiotics. Prothrombin ratio test was ordered. Good. We're going to see what is missing. I'm just looking at the grammar and the things you've done. Right? So if we look back at the letter, okay, if we look back at the letter, you've written the first visit where she presented with a productive cough for 3 days. You missed that point. Have you written it?
No.
You've not written it, right? You haven't written that she's feverish. You haven't written her vitals, right? You're supposed to write vitals. You have to write that she had on assessment scattered-bronchi, apical pensystolic murmur, right? You need to write that she was prescribed amoxicillin, right? Okay, and that a review was prescribed, like suggested in the next 2 days. Okay, you need to write this, Dr. Amber. Is that clear?
Yes,
Mhm.
it is clear. Yes, it
Good.
is clear.
All right. Okay. Good to know. Okay, let's read the rest of it. On subsequently, now if you write subsequently, after subsequently, you're going to put a comma, right? Subsequently on this date, severity of bronchitis. Again, you're going to say Mrs. Hong's condition worsened. Isn't it? If you say Mrs. Hong's condition worsened, now here is one more thing that you've done, Dr. Amber, right? You have written here 0702-2014. Now here you've changed the pattern of your date. You've written 9 Feb 2014. If you do that, do you think it looks good, Dr. Amber? I mean, just
No, it
aesthetically
doesn't.
saying. It doesn't, right? So you're going to write it in one way, all right? Either the slashes or the words. Okay, also I told you that if you write it just in numbers, then it is one word. If you write it in number and a word, then there are 3 separate words. Is that clear, Dr. Amber?
Yes.
Okay, good. Severity of bronchitis increased and developed early right bronchial basal pneumonia. At this stage, he was not dyspneic, but he had mild crackles at right lung base posteriorly. Few
Oh, sorry, it
investigations were
is she.
Okay, she, okay. All right, I didn't even notice that, but it's good, it's good. Her pronoun is her, right? Unless they are trans, okay? All right, or if they preferred being called he, okay? But she had mild crackles at right lung base posteriorly. Few investigations were ordered, including sputum sample for microscopy and culture, FPE, chest x-ray, and prothrombin ratio. She was advised chest physiotherapy and asked to follow up next day. Now, here is the thing. You've written a good one. This is the first time. Is this the first time you've written a letter, Dr. Amber? Ever?
Yes, it is. Yes, it is.
It is very good. It is very good. It is very good in that way. Now, let me just point out the mistakes. Number 1, always when you start the paragraph, this is for everybody else too, right? Don't just keep on looking at your letters and see what you've done wrong. Listen to each letter correction, because every time you do that, you're rewriting the letter. All right? Okay, guys? So see, here's the thing. Same pattern. Okay, you're going to have the same pattern of things, Secondly, you're always going to start in here with Mrs. whatever her name is, right? Then you start with sign and symptoms, right? First sentence in your paragraph is the presenting complaint, sign and symptoms. On this date, Mrs. whatever presented with severity increased with worsening of her condition, or on this date, Mrs. Hong's condition worsened as her bronchitis increased, comma, however, she had no dyspnea, right? Then full stop. On examination, right? After sign and symptoms, you talk about examination. On examination, she had mild crackles at right lung base. Are you following me, Dr. Amber?
Yes, I'm following you.
Posteriorly. Everybody clear so far? Okay. Posteriorly. All right. Sign and symptoms, examination. All right. Then you would say, a diagnosis, a presumptive or a probable diagnosis of early right basal pneumonia was made. All right, but this would be done after you've done the investigations, right? Okay, however, these are further investigations, right? So instead of saying few, now few is good, but it's a waste of words. How about you directly say, sputum sample for microscopy and culture, you have to open this up. You have to say full blood evaluation, because what is FPE? We don't know what's FP. Some countries say CBC, some countries say FBC, right? In Pakistan, it's also, CP. So you have to open this up. Everybody's saying different, using different words for FP. Isn't it right? Everybody agrees. Do you guys agree?
Yes, ma'am.
Is everybody still here? Yeah.
Yes,
Full blood.
we do agree.
Yeah. So full blood evaluation, chest X-ray. Okay. Prothrombin ratio. Okay. She was advised chest physiotherapy and asked to follow up next. And now here's the thing. I told you when we were doing grammar, asked is informal. You would say she was advised regarding. Every time you use the word advice, write regarding here. She was advised regarding chest physiotherapy, comma, and a follow-up. After follow-up, you have to put a dash here between follow-up, and you cannot lead this sentence like that. Follow-up is always a phrase. You're going to say follow dash up, then you're going to say visit. Is everybody clear? Are you following me? Because I'm about to end it. Right? Follow-up visit next day was planned. Are you clear, Dr. Amber? Is this making sense?
Yes. Yes.
Clear? Any questions? Okay. All right. Now, this is Dr. Fasi. Dr. Fasi, are you there?
Yes, ma'am.
Okay. It says, Mrs. Hong first presented, be very wary of your F. Dr. Fasi, your name starts with F too, isn't it? Yeah?
Yes, ma'am. Okay.
You got to change it. All right. All right, doctor, you got to change it. You're going to say Mrs. Hong first presented to my clinic. Again, you've done the same thing. No, to my clinic. All right. She presented to clinic, or even if you don't say to my clinic or you don't say clinic, you'll just say, right, initially or first, Mrs. Hong first presented on this date. Right, you see, you save so many words. 1, 2, 3, 3 words. You save 3 words, Dr. Fasi. You say, first, Mrs. Hong first presented on this date, complaining of productive cough over 3 days for the last week. Now, over 3 days is fine, but how about you say she presented with complaints of productive cough for 3 days, right?
Yes, ma'am.
For 3 days in the last week. For 3 days in the last week. For 3 days in the last week. All right. Okay. She had reported fever as well. Now, you know what? When you're going to write sign and symptoms, write it in one sentence. So you could say Mrs. Hong presented with fever. Ms. Hong presented on this date, complaining of productive cough for past 3 days in the last week and fever. Full stop. You see, I say she had reported fever as well. I just said and fever. So I say 1, 2, 3, 4, 5, 5 words. Yeah, Dr. Fasi, is that clear?
Yes, ma'am. Thank you.
On examination, she had moist cough with a scattered bronchi. Scattered S should be small, please. Yeah, they're going to look at it and they're going to cut marks if they see it, because you see slight, and here you've written she, H looks bigger than S. Here, S and C look the same. It seems like S is capital. They're going to look at it. All right, so you have to be careful. With scattered bronchi throughout the chest, and apical pentasystolic murmur was heard. Okay, she was slight hypertensive. What does it mean by slight hypertensive? We have mild, moderate, severe. Do we have slight, Dr. Fasi?
Okay, ma'am. Mild hypertension.
Yeah. No, don't even say that, because you don't know what mild is. You don't know which rules are they following. So you'll just write the you just write the blood pressure. It could be that it's normal for her age. Yeah.
Yes. Okay.
And had a pulse of, not have, had. Also, Dr. Fasi, when you go to the patient, first you check their vitals or you do the systemic examination, Dr. Fasi?
First we check vitals.
Vitals, so you're going to write the vitals first. First, you'd say on examination, she had a blood pressure of this much and a pulse of this much, full stop. On examination of the chest, right? She had moist cough, scattered bronchi throughout the chest, and apical pentasystolic murmur, full stop. Clear, Dr. Fasi?
Okay, ma'am.
Yeah. Regrettably, now when you do that, it just makes them sound so dramatic. Now, you as a doctor, do you feel regrets when the patient has more cough? No, you're like, fine, I don't care. It's your life. I'm just going to be here to treat you. Isn't it, Dr. Fasi? Is it true or not? Yeah.
Yes,
So you
ma'am.
could say subsequently, unless you're being dramatic. Unless you're being dramatic, you could say subsequently. You can say subsequently. You can say subsequently. Mrs. Hong's, I've told you every time you write a new paragraph, Mrs. Hong's cough worsened. Was increased. Can I replace it by worsened?
Yes, ma'am.
Cough worsened. Cough worsened. First, you see, if you say on 2 months later, how about you write here the date? If you write the date, then they can say it was 2 months later, yeah? Or you can start by saying 2 months later, Mrs. Hong presented with worsened cough and feeling tired and reported tiredness. And she reported tiredness. Yeah, can we say that, Dr. Fasi? Is it clear?
Yes, ma'am. Yes, ma'am.
Are you following me?
Yes, ma'am.
Everything clear, right? Okay. Then you can say crackles were noted on examining right lung base posteriorly, and of early night basal pneumonia
And
was made
assessment.
an assessment. Now you see, I cannot read it. If I was the examiner, I'll be like, what is he written? Even though you've got a good write-in, but if you do this, you lose marks, right, Dr. Fasi? Don't overwrite. Okay, try not to make mistakes. This is why I recommend writing with a 2HB pencil or any pencil that you might have. Yeah, you can write your letters with a pen, but I recommend using a pencil because, you know, in life you cannot erase things, but with pencils you can. Yeah, in exam you can. Yeah, Dr. Fasi?
Yes, ma'am.
Mm-hmm.
Okay.
Clear?
Yes, ma'am.
Okay.
In the
An
exam, we are
assessment.
going to write with pencil.
Yeah, it's good if you write with a pencil. I recommend it. You can use a pen, but I recommend using a 2HB pencil. Okay?
Okay.
All right. Okay. An assessment of early right basal pneumonia was made. Consequently, sputum sample for culture, CXR, I've told you, you can write X-ray. This is no place for Pakistani mnemonics, Dr. Fasi. You're going to say chest X-ray. Clear?
Okay, ma'am.
Prothrombin ratio and chest physiotherapy was advised along with a review for tomorrow as appointed. No. Now, you see, when you say for tomorrow, I'm reading the letter, for example, in 2021, and she came in 2014. Is that my tomorrow? You see the time, right? See, you're going to say, first of all, you're going to say, on this date or 2 months later, Mrs. Hong presented with cough and tiredness. Full stop. Okay? Mrs. Hong's condition worsened as she presented with cough, or you could say Mrs. Hong's cough worsened and she reported tiredness, right? Okay? On examination, you see, guys, this is not a competition. It is not a competition between Dr. Moaz, Dr. Zishan, Dr. Fasi, Dr. Misbah, Dr. Sarah, Dr. Amber. No, it's not. Right? This is a competition against yourself only. Okay? And by that I mean is that if there are certain sentences that you remember, please try and reuse them. If there are certain things that you're sure of, please write them. If there is a pattern that you've learned from someone else, right? Like look at from your previous self, you've written on examination. You don't have to show a variation here. You could just directly again say here, on examination. Dr. Fasi, are you following me?
Yes, ma'am.
Everybody
So
else following me?
I thought we should not repeat the same
No.
line like an examination.
No. Why can't you? Unless you're using regrettably here and you regrettably here, then it's a problem. Otherwise, you've done examination, so it's on examination, isn't it? Doesn't it make sense logically?
Yes.
Yeah?
Yes, ma'am.
Okay, on examination, right lung base. On examination, crackles were heard at the right lung base, and an early assessment of basal pneumonia was made. Consequently, this and this and this was ordered. Clear, Dr. Fasi?
Okay. Yes.
You guys, you know, you have to pay attention to one another's letter because you see, one letter with the same information can be written in so many ways. You're going to learn from one another. All right, let's check the next one. Any questions, Dr. Fasi?
No, ma'am. Thank you.
Okay. Dr. Zishan, is this, okay, no, this is Dr. Moaz, right, Dr. Moaz? Is this yours?
Yes, this is mine.
Okay. Okay, saying initially on this date, Mrs. Hong presented, now you see that thing that you've done there? Fine, it's
I
all
know.
right. You can do that. No, that's okay. You're learning. I wouldn't want you to do that. Presented, and you know, there is no, this is, what is this? What does it mean?
I know I have written it
This is
wrong. I should
Greek.
write with.
This is Greek. We're writing a letter in English. I think it's Greek or Latin. Yeah. They didn't have time.
Yeah.
They were, they were mathematicians, they were scientists, they were doctors, they were geologists, right? Al-Biruni was so many things. We got time. We're just doing one thing, medicine. Yeah. So we got time. We can write WITH. Yeah, Dr. Moas, is it clear?
Yes.
And in pandemic, we've got more time. I think so. On initially on this date. Now, you know what I recommend? I recommend either you write initially or you write the date. One of it. Because, it saves your words. Like over here, you've written on subsequent visit on this date. You could have written subsequently, comma. Or you could say on this date, comma. That's it. 1, 2, 3, 4, 5. 5 words. You can just use 2. Or you could just use 1 and say subsequently, comma. Whatever. Okay, Dr.
Okay.
Dr. Moaz, is it clear?
Yes.
Okay. Initially on this date, Mrs. Hong presented with fever, productive cough, thrice weekly. Okay, it's good.
I have written
Now,
it.
no, it's good. I appreciate it. Okay, it's a different way of writing. Then you've written, also don't be so self-critical. I'm here to criticize. Yeah, in a good way so that you'd improve. Okay, don't criticize yourselves because this is the first time you guys are writing it. How many letters have you written so far, Dr. Moss?
Almost, it's my fifth, sixth
letter.
letter.
Okay,
Yeah.
here's another thing. Unless you've written 15 letters, okay, unless you've written 15 letters without getting checked, right? Like you should get at least 5 or 4 checked, okay? But unless you've written 15 letters, don't start blaming yourself that I don't know what's happening. Yeah? Okay? Unless you've written 15 letters, you don't know what you're doing. You're getting oriented with the exam, aren't you? Yeah? So
Yes.
don't feel bad. Okay, you just started. 10 more and then we'll see if you're doing bad. Yeah? Okay? Okay. On examination, she had temperature. Now temperatures, T is missing and this guy feels lonely. This needs instant. Of 38, pulse rate was this much, atrial fibrillation. Okay. Okay. Scattered-bronchi, systolic murmur on auscultation. Fine. Everything was fallen down auscultation. The temperature was found on auscultation. The pulse rate was found on auscultation. No, you're going to say on examination, she had a temperature of 38 and a pulse and the pulse rate was 80 minutes per beat in atrial fibrillation, full stop. On chest, or you could say, full stop, the chest examination revealed a scattered bronchi and a pensystolic murmur. That's it. Or you could say on auscultation, scattered bronchi and pensystolic murmur were appreciated. Is that clear, Dr. Moss?
Yes.
Okay, this is a first session. This is why it's taking so long. Inshallah, tomorrow it's going to be 10. You guys are very tired. I'm sorry, but we need to go through this, right, guys? Okay, we all are busy in our lives, so we don't have much time to, go through things. I think this is the only time that we get. Okay. Now, assessment of acute bronchitis and smoking increasing severity of symptoms was made. Here's the thing. You're going to first say the assessment or an assessment. Yeah? You don't want to leave this guy alone. You want to put an article here. An assessment. Right? Or you could have just said on, you could have just said examination, but you said on examination. So the assessment or an assessment of acute bronchitis triggered or worsened by smoking was made. Yeah, that smoking is something that's making it worse. And smoking increasing severity of symptoms, right? It's fine. It's fine. It's the first time you're writing it, but try and reduce the word count. There's so many English words that you can use. And the ones that I'm telling you, please make a list. All of you, make a paper, take a paper, separate 2 pages, and write the words that I tell you that help you and reduce the word count. Are you all following me? Dr. Fasi, Dr. Misbah, Dr. Moaz, Dr. Amber, Dr. Zishan, Dr. Zahra? Yeah, do that. Go ahead, do that. I've been studying since morning, then I've been taking some more classes. I went for work, and I'm not a superhuman, but I'm saying that, we got this, okay? So stay a little vigilant. Okay, an assessment of acute, mashallah, an assessment of acute bronchitis and smoking and a trigger or worsened by increasing smoking severity was made. She was commenced on tablet amoxicillin, this is good, and advised to be reviewed 2 days later. Very right, very right, very right. On subsequent visit or on this date, Mrs. Hong complained, because it's a verb, isn't it? Complaint is a
Yes.
noun. Yeah, complaint of increased
Mhm.
frequency of cough with phlegm, feels tired. Felt, it's a past thing, isn't it? Felt tired.
Okay.
And stopped smoking on advice. As advice, good. You could say on this date, Mrs. Hong complained of increase in, or you can say Mrs. Hong's condition worsened. As
Hmm.
the cough frequency increased with phlegm and tiredness was reported. Okay? On
Okay.
examination, I'm not going to write the smoking bit here because after sign and symptoms comes examination. So on examination, comma. You haven't put a comma here too. You need to put a comma, right? On
Okay.
examination, comma. She looked worn out. Good. This is a good phrase, but you need to put a dash here. With high temperature, how much was the temperature? If you say it's high, what do I mean by high? You need to tell me what do you mean by high. Yeah? 38 is high,
Okay.
39 is high, 40 is high, isn't it? Isn't it, Dr.
Yeah.
Moss? You need to tell me how high. With AF. Okay, now it's good. She had crackle on right lung base. Was there only one crackle?
Crackles.
Crackles and occasional crackles on auscultation. Okay, rewrite this whole thing, right? You all are going to rewrite it, but I hope you understand this, Dr. Moss. Yeah, clear?
Okay. She had wrong. I wrote it wrong.
No worries, no worries, no worries, no worries, no worries.
Hmm.
This is the first time, right? Don't worry, don't worry. You're going to get there. Okay, we're going to get there.
Inshallah.
Yeah, good. Okay. Right, this is Dr. Zishan. Dr. Zishan, are you there?
Yes, ma'am.
Okay. You're saying initially on this date, again, the same advices, either write initially or the date. I advise
Okay.
that the first time you're writing it, write the date. Okay, the next
Okay.
time you're writing it, write subsequently, as you've done. Mrs. Hong presented at my clinic. Again, guys, I know you're the GP. I know it's your clinic. I know it's your hospital. They know it's your hospital. You know it's your hospital. The patient knows it's your hospital. It's very obvious. Let's not state this, all right? Okay, Dr. Zishan,
Okay, ma'am.
are you going to do that again?
No.
Okay, good. I mean, if you want to, you can, but I would say no, right? Because we know it's your hospital, all right? Okay, Mrs. Hong presented with the complaint of productive cough. Now, it's not just one complaint, is it? Is there just one complaint? I think there was something else too that you missed, yeah? She was feverish too. She said it
Yes.
herself, right? So you got to say that she complained of productive cough and fever for the past or the previous 3 days. You see, a person, if he's got fever, is he not going to have something else too? Do you ever just have fever? Or do you have cough and sputum and all the things together? Yeah. So what they're trying to say is, I don't know if you guys are going to take PLAB 1 or PLAB 2, or you're going to take MLE, or you're going to take COSMLE or MRCP. All of them have one thing. They're preparing you for the next one. OET is an exam that's preparing you for your written part of the future exams and your speaking part of the future exams, which is spaces, PLAB 2, step 3 CK, CS, right? So that's the thing. Okay.
Okay.
Additionally, there was Sketteronka. Now, additionally, when you say additionally, is fever like 3 or 4 or 5 things that you cannot that you have to put additionally there, right? For example, I said, she was poetic. She liked blue, black, green, orange, yellow, purple. Additionally, she was also fan of black. Yeah. So then you can
Okay.
say additionally that so much information, and now I need to add a connector.
And
This
to
is just
add
one tiny information. She had
more.
fever. Yeah.
Okay.
If she had fever, she had bronchi, she had abdominal pain, she had nausea, then you can say additionally, she also had this. Yeah. Also,
Okay.
I recommend that you write your connectors when you're changing your bit of information. For example, you're changing category of your information. Now, sign and symptoms is one category. Are you guys following? I know it's too late, but please hold on. Everybody alive? Yeah, alive by alive. I
Yes,
mean, like,
ma'am.
are you still here? Yeah, listening to me?
Yes.
Good,
Yes.
good. Appreciate it. Yeah. So what I'm saying is that, sign and symptoms is one category. Examination is another category. Lab investigations is another category, right? Diagnosis is another category. Advice is another category. When you're moving from one category to another, then only use your connectors, right? When you're moving from one category to another, then only use your connectors. For example, in this letter, Dr. Ishan has written, initially on this date, right? Mrs. Hong presented at my clinic with the complaint of productive cough and fever. Additionally, on examination, right? Because I changed the category. I was talking about signs and symptoms. Now I'm talking about
Okay.
examination. Yeah. Additionally, she had fever and all and all and all. Yeah. Okay, she was feverish. Additionally, there was a scattered bronchi throughout the chest. An apical pensystolic murmur was heard. She was diagnosed with acute bronchitis. This is good. But you know what? You as a GP are not going to diagnose it just on the basis of sign and symptoms. Tomorrow, I come and check you, right? I'm a doctor, right? You're my patient. I'm going to come and check you. You have fever, you have cough, and I can hear crackles. Can I say you've got acute bronchitis? Can it be viral?
No.
Yeah, it could just be a viral chest infection. It could be just the flu. So you're
Yes.
going to say a probable diagnosis, unless you have the lab results. Yeah. Okay. A probable diagnosis was made. Therefore, this is good. She was commenced on amoxicillin. This is good. Consequently, therefore, as a result of 3 times a day. Moreover, I told you specifically, Dr. Zishan, and everybody, don't write furthermore, moreover, hence. They hate this word as far as I know. Yeah. Okay,
Okay, ma'am.
because when you say moreover, there should be lots and lots and lots and lots of information in English before you start writing moreover. Yeah. Okay.
Okay, ma'am.
She was advised to quit smoking. Now, I've told you that if you want good marks, then after advice, every time write regarding. Make it a rule. I told you, please separate 2 pages. Write the phrases that I say, right? Always write, she was advised regarding smoking cessation. That sounds more professional. Yeah. Like you talk to a friend and you're saying, you know what? I quit smoking. But if a doctor is talking, if somebody more professional, more well versed is talking, he's going to say, you know what? I cessated the smoking. That sounds kind of poetic, right? They want to see if you can, like you have kind of, like some polished language. And you know what? Everybody's writing the same stuff and they're still getting parsed. And our job is to get 350. So use the same phrases. If you write another letter,
Okay.
then you can say she was advised regarding smoking cessation. Yeah, guys? Okay. On subsequent visits, Mrs. Hong's, okay, you see, on subsequent visit, Mrs. Hong's visited. All sounds the same. With the worsening of symptoms, although she was, so don't write it twice, she was taking all medications on examination. O should be capital because after full stop, you're writing it. Dr. Zishan, you're following?
Yes, ma'am.
There was atrial fibrillation along with mild crackles at right lung base posteriorly. I appreciate what you've written, but please write it clearly because when you say base, I can hardly understand it. Yeah, I'm a doctor and a pharmacist can read it, but OET examiner is going to be like, okay, what does it look like? It seems like a B, a U, a C. Is it a buck or is it HUC? Huh? So make it very clear.
Okay.
Yeah, you
Okay.
guys have got time. Just make sure that you write clearly. You don't have to change your writing. Yeah, just clear it out. Like, look at your R over here. Yeah, see? Nobody's this out. Trust me, if you go and take E2 and all those people, right? It's about the money too, but not that much, right? I'm not stupid that I'm doing it because I really want you all to pass. Right, guys? I really, really want you to all pass. Right? So this is bronchitis. Look at your R. Look at your R. It's missing a strand. What is happening to them? Are they paraplegic? Dr. Zishan, are they paraplegic? No, look at this R. This looks nice. This R looks nice. This R looks nice. Okay, so this R looks fine. Just kind of change it over just a little, right? Just use the pen over
Okay.
there, okay? I was just kidding, all right? Just kidding, okay? No hard feelings, okay?
No problem.
On subsequent visit, okay, on subsequent visits, Mrs. Hong's visited. Now you could say subsequently, Miss Hong now visited. Fine, she visited you. You know she visited you. Don't need to write that. Don't write the obvious. Mrs. Hong's condition worsened. Worsen, obviously the condition is worsening of symptoms. It's very obvious, isn't it? What worsened? You need to write that. Yeah, you have to be careful. She was taking all medications. What medications? You could say she was compliant, but what did she have? She had phlegm. Many of you have missed it. I hope you're pointing your mistakes out, because I'm not going to do it for each of you, right? I've told you, you all are missing things. Please write those things down. She had phlegm, right? And she had also fever. Her condition had worsened, wasn't it? Isn't it? Just look at over here. She was tired, okay? Worn out. You need to write that. Okay, let's move ahead and end this. Okay, on subsequent visit, Mrs. Hong visited the worst. Okay, fine. She was diagnosed with early right lobar pneumonia. You'd say a probable diagnosis, right, Dr. Zishan? A probable diagnosis, right? Okay, guys, this is the first time. I know it's overwhelming. I know it's too late, but you're gonna do it, inshallah. Okay, next thing. Initially on this date, this is Dr. Zahra. Dr. Zahra, are you there?
Yes, ma'am.
Okay, you waited too long. Okay, this is very clean, which is good thing, right? All of her writings are mashallah good. Just make it a little clean, right? So the examiner has been watching, he's been looking at so many letters, and then he finds this letter, he's going to be happy. Just think about it. That person's not a computer, right? So if you want to impress them, right? They look at it, they're going to be like, all right, okay, I'll give them 1 mark, 10 mark for just cleanliness. Yeah, guys? Okay, my writing's the worst, but when I had this exam, I tried and made sure that I'd make it clean. Everybody clear? Please do that, okay? Initially, comma, on, comma, so many commas. Just write one thing, either initially or the date, okay? Because these are 3 words, 1, 2, 3. All right, Dr. Zahra,
ma'am.
clear?
Yes,
Initially on this date, Mrs. Hong presented with the complaint of productive cough for the previous 3 days. Good. However, she had no dyspnea or pain. Good, good. See, guys, what she's done? She has wrote the negative symptoms too. You avoided it. Because, later on you find out that, she develops dyspnea. She develops pain. Is everybody clear? Please write that. On examination, she had moist cough, scattered bronchi throughout chest.
true.
Throughout chest. Okay?
Yes.
And apical
Okay.
systolic murmur was heard. You can't just leave things in the middle. And
Okay, ma'am.
N apical and N apical. You can't just leave apical on its own. N apical pentastolic murmur was appreciated. Additionally, her blood pressure was this. Therefore, she was advised to cease smoking and amoxicillin 3 times a day was prescribed. That's it, Dr. Zahra?
Yeah, ma'am. Sorry, my speed is so slow because
That's okay,
it's
that's
my
okay,
first
that's okay.
letter.
How
So
many? Good. All right, this is the first time, it's good. Okay,
yes,
did you guys learn anything at all?
a
Anybody
lot of
learned anything?
things.
Okay, good. So now what I
A
want
lot
you to
of
do is,
things.
now what I want you to do is go through this letter, write it on its own, send it to one another, and strike a discussion in the group. Yeah, guys, because we are done with it. Okay, I don't want you to write it or send it to me, or if you want, I'll check it for you. It's up to you. But there are lots of other letters. So what you could do is that you could just send it to one another in the group, write it in the paragraph, right? In the paragraph form, write it and send it on the WhatsApp, and I'll check it for you guys. Okay? All right. What is your
Yeah.
task? What is your task? Your task is that you're going to write the last visit and the conclusion. That's the task. Okay. Any questions?
No.
It's because you guys haven't watched the past videos. Please watch them. Okay.
Yes.
At least the first one. Okay. And I'm going to see you tomorrow at 10